So how much fat does actually survive after a fat transfer surgery, whether into the buttocks and the hips or the breast? Now, this depends on a lot of factors. So first of all, the patient's anatomy. Now, when you do a fat transfer, you're relying on new blood vessels forming into those fat cells to be able to supply the fat with oxygen and nutrients for it to survive and live in that area and call that area its new home. It's very different to putting a prosthesis like a breast implant in which you don't need any blood supply. So when you do a fat transfer to the back of the bum, in the buttocks area, now because there's a large glute muscle right underneath it, the fat is able to get very good blood supply from there, and typically in my experience, about 80% of the fat will survive. However, in the hips, which also is part of the fat transfer in the gluteal hip region, fat retention is a lot less. It's more like about 50%. And the reason for that is under that area, there is no muscle under there to directly send blood vessels to above fatty layers. You're relying on blood vessels coming from the top part of your quadricep muscle and the outer parts of your gluteal muscle to send some blood supply. So that's generally about 50%. Now in that region, the other big factor is the amount of space that the patient has. If the space is inadequate and we try to overfill the area just for the sake of getting more fat in there, inevitably, because the pressure is so high, it's going to be very difficult for blood vessels to form and hence a less survival rate. And the big thing is obviously after a fat transfer to the buttocks or the hip region, you can't apply any pressure to the area for the first 6 weeks. The compliance of this on the patient's behalf is one of the biggest factors in determining how much fat will stay there long term.